Hi, and welcome to this presentation on the chart review of the cardiorespiratory patient. During this session, we will cover why the chart review is so important, what key information you need to look for, and how to form a hypothesis from this information. The chart review is vital as it will give an accurate picture of what to expect during your patient encounter and lead you to determine how your assessment should be tailored. It can determine the patient's current status and the course of illness, specifically if your patient is improving or deteriorating. It will also help to give an insight into the appropriateness of a physiotherapy intervention. Is the patient stable enough for a physiotherapy intervention, or is there any evidence that physio intervention is actually required in this patient? The medical chart might document that the patient is mobilising independently on the ward and is being discharged home this morning, in which case you can question if physiotherapy is really necessary or get more specifics about what the referrer would like physiotherapy assessment for. The chart review can also prevent doubling up of questioning for the patient. Much of the information you need to know as part of your assessment may already have been asked and documented in the medical notes. This will prevent exasperating the patient with the same repeated questions and thus help to build rapport, and very importantly, it will help you manage your time more effectively. Use the time to confirm key pieces of information and seek any missing relevant details. If your patient is a surgical patient, the chart review can detail things that might indicate that they are at higher risk for post-operative pulmonary complications. We will talk more about this later when we discuss management of surgical patients. The other vital information provided by the medical chart is baseline status and identification of any potential discharge barriers so the patient can get home as soon as possible. Most hospitals would keep documents for the current admission only in a separate file. The main patient file can be referred to for previous admissions, outpatient visits, old physio notes, etc. Remember that some hospitals might even use online notes. Most of the information you will need should be able to find in the progress notes of the current hospital admission documents. The key features of a chart review include history of presenting condition, which is a summary of what is their current main issue, including length of time and course of symptoms. The past medical history is important, along with a detailed drug history, which can help provide confirmation of medical history and fill in any gaps. It can also help identify cautions to physiotherapy interventions. For example, patients on beta blockers will not have a usual cardiovascular response to exercise. Some of their social history may be included, although it is likely you will have to question further to get all the information we are interested in as physiotherapists. Specific examination results may also be recorded, as well as medical examination findings, medical diagnosis, and medical plan of management. The types of specific investigations you may see the results for in the notes include pulmonary function testing, chest imaging, arterial blood gases, ECGs, sputum analysis, and blood tests, amongst others. Remember, this information is all really important to understand as it helps guide our assessment and treatment planning and make sure we are providing a safe and effective intervention. Let's consider a patient who is admitted to hospital with acute kidney failure after a urinary tract infection. Their potassium is recorded at 6.2 in the notes this morning, but last night the doctor had referred them to physiotherapy. Did you know that potassium is the drug they use to stop the heart in a lethal injection? If it exists in your body in high enough quantities, it can cause a lethal dysrhythmia. So do you want to be exerting this patient today? The information from the chart review should be used to form an idea in your mind of what you expect the patient's main impairments to be. This is important as it will help you to plan and order your assessment appropriately and tailor it for each specific patient. Why is this so important? You will learn as we go through the module that there are many physiotherapy assessment techniques that we use in the cardiorespiratory patient, but not all are necessary or even safe for every patient. Conducting an assessment particular to each patient will ensure better use of your time, as well as an improved and safer patient experience. For example, you are asked to come and see a cystic fibrosis patient as they have been admitted with an exacerbation of their condition. You know that usually physios like to keep track of spirometry findings of patients with CF, but this patient's on high flow nasal prongs and is in respiratory distress. Is spirometry safe to use in this patient? Also consider how accurate it might be in this situation. Thanks for listening to this presentation on the chart review of the cardiorespiratory patient. Next, we will go on to start looking at our subjective and objective assessments.